If you accidentally post a picture that contains protected health information in the background of a social media post, it's still a breach. Posting videos or pictures of patients is also a breach if you don't have proper authorized written consent. Sharing any stories about patients can violate HIPAA, even if it doesn't include the patient's name or if it's within a private group of people who are permitted to know the information. If it includes any information about a patient, don't post it. It's necessary that you keep work and personal life separate so that you don't face any kind of charges, fees, or even lose your job. Unfortunately, some healthcare employees still fail to follow HIPAA when it comes to social media. Hi everyone, I'm Matt Moneypenny, and today I'm going to give you 6 real-world examples of social media HIPAA violation, each of which were officially reported by local news stations.
Before diving deeper into this subject, make sure that you subscribe to our YouTube channel. Also, click on the alert bell icon so that you're notified when we post new helpful content.
A dental practice replied to patient reviews on Yelp, a business review platform. It doesn't sound very harmful, but their responses included PHI. A patient complaint led to an investigation that uncovered that this wasn't the first comment the company made containing PHI. The healthcare company had to pay $10,000 to settle the complaint. A medical group failed to inform a patient that her medical information was breached. The patient originally learned of the breach herself when she saw her information posted on Twitter. A hospital employee was dating the patient's ex-boyfriend and looked up her information without authorization. She then shared this with her current boyfriend, who posted it on his Twitter. The employee that illegally looked up the information told police that someone else must have looked up the information after she logged into the system, but this just wasn't true. The employee was fired for the incident. A hospital nurse was fired for posting details of a measles patient. The patient was too young to receive the vaccination before contracting the disease, which caused a painful rash and a high fever. The nurse was also an anti-vaxxer and posted details of the child's condition to a private anti-vaccination Facebook group. The problem was her profile listed where she worked, and it turns out that one parent in the group had a child in the very same hospital that she worked. Worried about the exposure to the disease, this parent posted screenshots to the hospital's Facebook page. This launched an entire investigation, and the hospital immediately suspended the nurse. She deleted some of her comments because she realized she had made a mistake, but it was too late. The hospital fired her for sharing those details. A patient care technician in Northwest Indiana posted PHI from a former high school friend. The technician posted the patient's full name, date of birth, and that the patient had a sexually transmitted disease, specifically HPV. The post stated that the employee wanted to expose the friend. The patient received a letter stating that the hospital took action based on its policies and procedures. An employee from a massive medical center in North Carolina posted a photo of an infant patient with words printed across her face. The employee did not have permission, and the medical center immediately informed the family of the breach and that appropriate action was taken. The company didn't release specifics about the breach, but they did say that they have a zero-tolerance policy and have fired employees in the past for breaches. This was the healthcare company's 6th violation related to social media in 3 years. A reality TV show star worked as a hospice nurse and a home healthcare aide where she lived in South Carolina. She sent a video with a pediatric patient to one of her fans over Instagram direct messaging. The fan reported her to South Carolina Board of Nursing for violating HIPAA. Other fans would encourage her to post pictures with her patients, and although the star said that this would be a violation of HIPAA regulations, she posted some anyway. Some employees post PHI for personal agendas or simply because they don't understand what makes something a HIPAA violation in the first place. Even though the details might be interesting, you should always keep them to yourself so you don't face fines, criminal charges, or even job loss. If you want to learn more information about social media HIPAA violations, reach out to Etactics. And if you enjoyed the video and you made it already this far, you might as well share it, like it, and comment below.